I'm Margaret Bradford. I'm here at the Cleveland Circumcision Protest with the Bloodstained Men. We have a lot of people out here today who are standing up for boys' rights against genital mutilation and infant circumcision. I am the mom from the viral breastfeeding photo at a political rally earlier this year. It was picked up by international media. I met a lot of really awesome activists through that. I got to talk about my activism with several news outlets, including Inside Edition, Cosmopolitan, People Magazine, USA Magazine, and some others. I am a regret mom. My son Gavin was circumcised on his 8th day, and he hemorrhaged, ended up getting a serious blood infection, went septic. We were told on 2 separate occasions that we should prepare to say our goodbyes. He managed to pull through because he is also a CHD patient. We had to delay his open heart surgery, and that has caused extensive medical issues for many years now because of how long he had to go without his heart surgery as a result of his infection. He is almost 4 years old now, spunky little thing. He will require future surgeries to repair the damage that was done when his botched circumcision. He has extremely painful scar tissue blocking half of his urethra. And so that's why I'm out here today, to warn other moms that this minor procedure that doctors tell us is okay and normal is not okay, and it is not normal, and there are very serious consequences. Your son could easily die from it. Mine was almost one on 2 separate occasions because of this one procedure. And so that's why I'm out here today, to try and hopefully encourage some other moms not to make the mistakes that I made.
Margaret, thank you for telling your very powerful story.
Thank you.
How effective do you find it is sharing your story with other moms?
I think that this is the thing that helps me the most, is being able to come out here and tell them that, you know, this is not just something that I have heard about. This is something that I lived through, and that my son will now live through with the pain for the rest of his life, and that is something that I have to now deal with, the guilt and the regret. And coming out here and telling people our story is my way of making amends to my son and telling him, I am sorry for the decision that I made. I am sorry that I consented to a cosmetic procedure that almost stole your life.
And you mentioned, we were talking about breastfeeding. You're an lactivist.
Yes.
We mentioned that one of the problems, in addition to the other, from his circumcision, was that he refused to breastfeed after circumcision.
Yes, he stopped breastfeeding for about a week, and it got so serious to the point where they had to put an NG tube down in his nose because he would not latch, he would not suckle from a bottle, he would not take anything at all. And then after he developed the infection, which was compounded with his heart defects, he lost the ability to eat entirely. And although his doctors will not confirm it, I believe that has led to part of the reason why almost 4 years later he is still on a feeding tube.
Did the doctors ever acknowledge that the circumcision was the cause of his infection and the beginning of this host of medical problems?
They did, only because it was very hard to deny. I think if they had had the ability to deny it, they would have. But he did hemorrhage immediately after the surgery. He required several blood transfusions, and the infection started in his penis and then went directly into his bloodstream. So there was no way for them to deny the fact that it was his circumcision that caused it. Because of the infection and his heart defect, he did go on the ventilator for several months, and by the time he came off of it is when he had lost the ability to eat entirely. They will not confirm the fact that this was a result of his circumcision, but I am 100% sure that had he not been circumcised and needed the ventilator, he'd be eating today.
Do you want to name the hospital?
Akron Children's Hospital.
Akron Children's Hospital?
Yes.
Wow.
In their NICU. And they knew that he was a heart patient when they performed the circumcision. They did not tell me that it would have extra complications, chance of complications from his heart defect. And this was a child that they had originally told me was also incompatible with life, that medically fragile, and they still chose to not tell me how much of a risk it was to have him circumcised. They just wanted that extra dollar.
Thank you, Margaret Bradford. Thank you for your work in trying to reach other moms, and we will prevail, and Tackleton will prevail, because parents love their children, and when they find out the truth, they say no.
Human rights always stands on the right side of history, so I have no doubt we're going to win.
Thank you, Margaret.
Thank you.